Hey guys, Dr. Ben here. Let's do a live Q&A. So bring your questions, pop those down below. Anything you've got, bring it at us. Definitely health related would be preferable, but whatever. I'll answer any question there. So go ahead and pop those down below. Remember, when you're asking a question, I want you to think about it here. I want you to think about not how much of this supplement should I take, is this good for me, or whatever it is, but start asking questions about the why. Why am I getting reflux? Why do I have fatty liver? Those are the things that I want you guys to think about. And even when you see somebody else's question pop up there, that's what I want your thoughts to instantly go to is, why is this person having these issues? So welcome, love having you guys on. We get all types of different questions. You can ask about your immune system. You can ask about thyroid, autoimmune, all types of different things. So pop those down below. We'd love also to see where you're watching from. We have people all over the country, all over the world. There's a little bell up top that Facebook just told me about, that instead of just following the page, you can actually get notified when we go live. So there's a little bell. Make sure that I think that it's filled in, and then that means that you're going to get notified when we go live. And if you ever want more videos and to be able to go through and organize those and see, hey, can I learn about the thyroid, or can I learn about digestion, or whatever it is. Hey Janie, good to see you. On YouTube, follow our YouTube channel, and you can search them a whole lot easier than on Facebook there. Hey Robin in Philadelphia, great to see you there. So one question that we had that I'll go ahead and get it started with, we asked earlier, how many chews per bite do you take? So I always have to think about that. Is it bites per chew or chews per bite? But how many chews per bite do you take? And really, hey Andrea, really what we're looking at is you should be between 30 and 40 chews per bite. Hopefully my wife's not watching this, because she's got one of those ears that can hear like everything. And so especially cabbage is just so crunching. You got to be careful who you're around, maybe turn the music on, but you need to make sure that you're chewing that very well. That chewing motion actually stimulates the salivary glands. We start salivating. We get more breakdown of our food as we do that. The juices are coming in, so you need to get enough of those chews in. That starts the whole digestive process. So think about it this way: if you've got digestion issues at all, here's optimal digestion. Optimal digestion is you're hungry, you eat, chew, goes down, and you don't think about it again until you have to go to the bathroom. And then you have a nice bowel movement. There's no gas or cramping or diarrhea or constipation or little rabbit pellets or whatever. It comes out. It looks like a little 3-year-old. You're like, holy cow, how did that come out of a 3-year-old? And it moves through. That is normal digestion, normal bowels. If you've got anything else besides that, gas or bloating or indigestion or reflux or constipation or diarrhea or any of those things, it is not working well. So you got to start from north to south. So you've got to start with your mouth. Even the smell is important, and that's the importance of like cooking your meals and letting those, whatever it is that you're cooking, those smells coming up, and even smelling gets those juices flowing as well. So Yolanda, is it possible to naturally dissolve a goiter? So you cannot dissolve a goiter by like putting drops of iodine on your thyroid, and that goiter will go away. So it won't dissolve it that way. Can the body reabsorb a goiter? And let's say that 3 times fast. Can it reabsorb a goiter? Yes, it definitely can. We've seen it. You can see pictures online, all types of things. So goiters can absolutely go down. There's different things that are contributing to goiter. Again, for anybody watching that doesn't know what that is, that's where the thyroid gets swollen, and you'll see, if you want to see some freaky pictures, Google thyroid goiter, and I mean, some of them are looks like this huge growth in there. But ultimately, you got to figure out why that thyroid thyroid is not working well? Is it Hashimoto's? Is it just low thyroid? What's going on to cause the body to get that goiter? So there's no natural thing. You know, you can take iodine, you can take selenium, some of these different nutrients that are going to be helpful for the thyroid, but vast majority of the time, it's not just an iodine deficiency that's causing that goiter. Most people nowadays, that's not the issue. There's other things going on. But yes, it is possible for the body to reverse that goiter. All right. Candy, great to see you. And again, go ahead and share this with anybody out there. Share this video. We are doing a book giveaway. So every day until we hit 50,000 followers, we'll be giving away one of my books. So if you share this video today, go ahead and give that out. Robin, my son seems to have an upset stomach each morning. He cannot eat anything. I hate to send him to school on an empty stomach. What is going on there? Well, a lot of people, if they feel nauseous in the morning, if they feel yucky in the morning, a lot of people, that is actually a low blood sugar state is why they feel that way. Which I always thought was interesting, because if you get low blood sugar, if you get hypoglycemic during the day, you're going to feel hungry, you're going to feel hangry, you're going to feel like, oh my gosh, I need to eat something, I'm crashing. But a lot of people, if they wake up and if they're hypoglycemic in the morning, they actually can get that upset stomach. So that's one of the things to look for is there a hypoglycemia going on in that child? You could give a little snack before bed, maybe a quarter of an apple and a little scoop of almond butter, a slice of turkey breast and a slice of cheese, something to keep that blood sugar stabilized throughout the night. You could also try like a protein shake, a little smoothie shake, something like that. So just to get some calories in, get some nutrients in, help that blood sugar so that it's not crashing down there. So give some of those a shot and see how that goes. Janie, CRP levels, where are the ideal levels a person should safely be at? Okay, so, and can cranberry juice help lower CRP? So CRP, the American Heart Association, the CDC, whether you listen to those guys or not, they both say anything over 3 is a very high risk for future cardiovascular disease, but even anything over 1, I looked at a lab yesterday and it said average risk for cardiovascular disease 1 to 3. And you're like, oh, that doesn't sound bad. But then you think about it, and 400,000 people a year die from heart attacks, and we get strokes and all these other things. So, do you want to be average risk on your heart disease? No. So 1 to 3 is an increased risk. 3 and above is a high risk for future cardiovascular disease. But that's not the whole story. If somebody's 26 and they've got high CRP, they're not going to keel over from a heart attack next year, but they have a lot of inflammation. So CRP, it can correlate with cardiovascular disease, but that is not the whole story. It can be just general inflammation as well. And so, if people are puffy, a lot of times somebody comes in and I just kind of squeeze them, squeeze their ankles, their feet. Do this right now. If your shoes are off, look at your feet. If they're not, unless you're like at work or something and can't do it, but take your socks and shoes off and do this with your toes and lift your toes up. And if you can't see your tendons like this, you have inflammation. And if it's just kind of this mushy over there and you can't see your tendons, you have inflammation in your body and you need to take some massive action to change that. And so, can you just take cranberry juice to help lower CRP? Again, for everybody listening, and like we talk about, the first thing you should think about when you see that question is why? Why does somebody have CRP in the first place? And does just taking cranberry juice lower that C-reactive protein? No. If somebody's still doing everything that they were doing before that's causing problems with that CRP, it's not going to change it. Just like if somebody has high uric acid, if they have gout, all those things, and they don't change their diet, don't fix their liver, don't fix their inflammation, their blood sugar, all these things, and they just drink some black cherry juice, they are not going to get that uric acid down. So just by doing some cranberry juice is not going to fix that. You've got to get to that underlying why, which you are, Janie. We're going to get there. Bert, I have a chronic clearing of my throat, drives me crazy and everyone else. I am not a smoker and I have had food and environmental testing done. So here's the thing. It may not be a full-blown allergy. It may not be a, oh, I've got allergies to gluten, or I've got allergies to corn or soy or ragweed, whatever it is. It can actually be that just certain foods are a little bit more irritating anyways. If you think about any like musicians, singers, things like that, they don't drink milk the day they're performing because they know that it's more mucus producing and they're going to have more mucus in their throat, and they're going to not be able to sing as well. There's going to be less of the good vibration in their throat that they want, and all these issues. So certain foods are going to be more mucus producing regardless of whether you have an allergy or you've checked it on your environmental list, any of those things. So dairy and gluten both are very mucus producing foods, and so unfortunately some people just do better off of those as well. That chronic clearing of the throat, sometimes there's chronic sinus issues, and even maybe you're living in a moldy house or working in a moldy environment, but that can be a big part of it. So again, welcome everybody that's jumped on since we started this live Q&A. Pop those questions down below, write in where you're watching from. Love to see where you guys are at, but go ahead and bring whatever question, as long as it's within Facebook parameters. I will answer some of those. And are you able to help with joint issues or injuries? So Ashley, this is a really great question. I was just talking about this yesterday. So I've done some things over my life to damage certain things. If I put my elbows out like this, you would see that one of them goes kind of at an angle. I've broken my ankle, I've broken my wrist, injured my low back, had hyperextension of my knee, a lot of different things. And yet, because of the way I eat, because of the way I sleep and the things that I do, I wake up in the morning and feel great. I don't have aches and pains and all these things that a lot of people that have damage. We've got a lady a couple months ago came in and been to the orthopedic doc. They said, you're pretty much bone on bone. We're going to need to do knee replacement at some point. She's in a lot of pain. We got her inflammation down. We got her metabolic system changed, got her blood sugar stabilized, all the things that she had out of balance. Literally within 4 weeks, I saw her, she was sitting in front of me and swinging her knee, and like, I don't feel pain at all in these. The bone on bone didn't change. It's not like we extracted her knee and gave her a bunch more space in there, but as the inflammation goes down, those joint issues or injuries get way better. Sometimes it is just okay, you know what, that certain muscle's not firing, something's out of place, you need a adjustment, you need a massage, you need a physical therapy, some of those things. And so yes, there are things that we can do for that, but ultimately you've got to make sure that your metabolic state, your inflammatory state is where it needs to be and not driving those injuries. Because I always think about it this way. If you did x-rays on everybody, some people that have, let's say, low back pain, their low backs could look way better than somebody else that doesn't have as much pain. And then there's some people that they're in that way more pain than they should be, versus somebody else is in way less pain, even though their back is really messed up. So it's not an apples to apples in there. So let's go here. Heavy metals are a big cause. Yeah, we got to look for heavy metals. How do you feel about providing iodine and hydrogen peroxide solution as a gargle for virus COVID? Absolutely. And it's not just COVID, but yes, like you said, any viruses, bacteria, that's a great place to go. You can do that hydrogen peroxide and that iodine. You can do it in your nasal spray after going out to Costco or the mall, or on Black Friday when you're racing through Best Buy or whatever you're doing and you're getting exposed to germs. You can spray those and you can gargle as well in there. And it's not bad anyways. We talked about the mouth yesterday and doing the apple cider vinegar for a minute, doing the food grade hydrogen peroxide for a minute, and then brushing your teeth after that. And like, I pretty much guarantee that if you do that twice a week, your teeth, you're gonna go to your dentist the next time and they're gonna be like, holy cow, it's been 8 months. Why are your teeth so good? Hey Stephanie, good to see you there. And thanks for the shares, guys. Again, we'll be giving out a book to anybody that shares this. We'll be picking one of you guys and give a book out to. What is best for severe heartburn at night? That is a great question, and it's definitely multifaceted. There's a lot of different reasons why we might be getting severe heartburn at night. But think about it, the main thing that could be happening to get that heartburn is there's a valve that opens and closes between your esophagus and your stomach. And that valve should close at the right time. When food has gone through and it's sitting in the stomach, it should be closed. And it should open when food is coming down, tries to go through, and then closes after it goes through. But what happens for a lot of people is that valve does not close like it's supposed to. And that's when we're going to get reflux up into the esophagus. We're going to get that burning, heartburn, any of those things. So then you go lie down, and that heartburn, that stomach acid is going to regurgitate through that little valve, and we're going to get irritation, burning, a lot of different things. And then if you eat spaghetti sauce or some people tomatoes and different things, that can agitate it and cause more in there. So if it's the valve issue, one of the really good ways to test that is you take your toothbrush or a popsicle stick, whatever, and you see if there's a gag reflex. And if you don't have a gag reflex, the same nerve that stimulates that gag reflex stimulates that valve in between the esophagus and stomach, and that's called your vagus nerve. And an easy thing that you can start doing, we call it gag, gargle, hum. And so every time you drink, you want to gargle. That's awesome. I've never done that live, but so you want to gargle, and not just a little, but like a big, like really, really intense gargling can help stimulate that nerve and get it to open. The other one you may not want to do, but if you want to, it's a coffee retention enema, which takes it to like a whole nother level of dedication, where you've got to put that coffee enema in and you got to hold it and hold it and hold it, and it stimulates those nerves and all that. A lot of people won't do that, but try gargling and you can get there. The other thing that happens is you actually don't have enough stomach acid. And again, this is such a big why for so many people. As we age and as we're under stress, anybody give me a thumbs up if anybody's doing those out there. Any aging or any stressing. So as you age and as you stress, you're producing less stomach acid. And we see this all the time. It's why we do a brain map on everybody. There's some thumbs up. I don't know. Hopefully it's just the stressing, because you can get rid of that. The aging, I don't know. I think we're all going that direction. If we're under chronic stress and different things, we're not going to be producing enough stomach acid. So what happens there is that we're not going to produce it, and the food is going to sit in the stomach for too long. So it's going to sit there, it's going to ferment and kind of get gurgly and bubbly and start pushing up on that valve. So even if the valve is working as well as it should, it's not going to be able to resist that, and then especially if you lie down. So this is why it's so important to not drink fluids with your meals, because you actually dilute that stomach acid. So if you have a couple sips, that's fine. But if you're sitting there drinking an iced tea or two during your meal, you're going to dilute your stomach acid. Food is going to sit in the stomach too long, and then we're ultimately going to push back up on that valve, and we're going to regurgitate and get some heartburn. So that was a lot. If you got more specific questions on that one, send us a direct message and we can get through there. But again, you've got to keep looking deeper and not just go, ooh, should I take some slippery elm and that's going to fix my issue there. My 48-year-old obese daughter is in her 8th day with COVID. She's on ivermectin, hydroxychloroquine, monoclonal, and steroids. I mean, that's if she is doing all of those things. We've seen the monoclonal antibodies do really well with people. Those are some really good things. If she hadn't been on vitamin D, bump up her vitamin D for a lot of people. And again, you've got to know your own health status and check with your doctor. But if somebody's coming down with a cold or flu, something like that, we'll bump up their vitamin D to 50,000 a day for 3 days in a row. So that can really jumpstart that. If somebody's not pregnant, which I'm assuming 48-year-old daughter is not, vitamin A, high dose vitamin A for 3 days is really helpful as well. Those are some of the good things that can be helpful. If they can get into sauna, I would get into a sauna and really warm that body up as well. Even the nebulizer could be helpful. Keep an eye on if you don't have a pulse ox, keep an eye on that. You don't want her to drop below 90. If that happens, then you've definitely got to take some massive action. If she needs to get some oxygen therapy, look locally for some oxygen therapy as well. I know someone who has severe stomach issues, pain, and doctors can't figure it out, and he can't get any relief. So Deanne, we've had people come in. We've had a lady, she was throwing up every day, just had our team meeting on Tuesday, and we were talking about one of the success stories. She was throwing up every day for a long time and is no longer throwing up every day. We've had people come in having diarrhea 20-30 times a day, and now they're down to 1 or 2, feeling great, digestion is good. So can those get better? Absolutely. There's usually a food involvement, there's usually a microbiome, good stuff, bad stuff involvement. A lot of times there's a brain part of it as well. So if somebody's in a chronic fight or flight, they're not going to be able to break down like they're supposed to, and going to have more issues in there. Send us a direct message if you got any more questions on that one. And again, anybody out there watching, if you've got questions, if you're having health issues, get a hold of either one of our offices in Nashville, in Colorado, and Fort Collins here. We'll be opening up a second one in Nashville in December, and then open up in Denver in January. And so we can work with patients remotely all over the country. We've got a great team, great trained doctors, metabolic coordinators, a lot of people to take you by the hand. So Bert, you are welcome. Bless you as well. Watching from Lubbock. Hey, Brandy, great to see you. Hope you have a great day. Susan, West Virginia. Do you treat adult ADHD, anxiety, and adrenal fatigue? Actually, those go hand in hand. If somebody has this chronic anxiety, if it's ADHD, which is the hyperactivity side, that's usually this high alpha, and that is going to keep somebody in this chronic fight or flight, go, always waiting for the mountain lion to jump on them. And so eventually those adrenals will start crashing down. The other thing that we see with the adrenals, number 1 and number 2 main stressors for the adrenals are that chronic brain spinning like that, as well as blood sugar swings, especially the dips. Every time that blood sugar dips down, the adrenals get stimulated. So those two things, if someone's got adrenal fatigue, you gotta fix those first. That's why we do the Brain Map ADHD. 2013, the FDA approved the Brain Map as a diagnostic tool for ADD. So we're able to pick that up very quickly. And the great part, once we start doing the neurofeedback, we can see changes very, very quickly. We can even do that neurofeedback remotely as well. See you all firsthand. Susan, great to see you. Thanks for the kind words. And Nancy, thank you. Good to see you. How can I get my TSH level up? It is 0.3 to 0.5. Other numbers are in normal levels. So Bob or Holly, I imagine it's Holly because there's 8 times as many women that have thyroid issues as men, so I'm assuming this is Holly I'm talking to. The TSH, 2 things. If TSH is low, then one is you're on medication, and if somebody's on medication, very hard to get TSH up through there into the 1.8 to 3 level. It's kind of more of that 1.0 is where we like to see people if they're on medication. If it's just TSH is low in general and you're not on medication, that's usually more of a pituitary issue. So the pituitary kicks out TSH, thyroid stimulating hormone, and so it's not a thyroid hormone that you've got going on out of balance here. TSH is a pituitary hormone. Pituitary also, just like Ashley's question just had about the adrenals, the pituitary also tells the adrenals what to do. And so if we have chronic adrenal stress going on, the adrenals are being whip. The pituitary is going to get tired and not tell the thyroid what to do as well. And so a lot of times we will see hypothyroid. So my guess is that your thyroid numbers are at the lower level, maybe not low, but at lower level, and that it's a hypothyroid secondary to hypopituitary. So we've got to figure out why that pituitary would be tired in the first place, why the jockey would be tired. Hey, Michelle, great to see you. Cincinnati Bearcats. All right, Lisa. Yeah, number 2. Can you believe it? Oh, good. Yeah, you got your book. Leslie, you are so welcome. Deanne, thank you. Brittany will be picking one out here in the next couple hours. We'll get a book shipped out. What are your thoughts on Accutane for a 14-year-old girl? Accutane, do a couple quick Google searches on negative effects of Accutane, and I've seen a lot of women in their 20s, 30s, 40s now that have been wrecked by Accutane. So I would do like anything possible to not go on Accutane. I've got 4 boys. I don't have to worry about it for girls, but Accutane would be the last place I would go. Think about this. I'm assuming it's for skin, acne, whatever it is. 2 things on the skin. One is it's actually a gut thing, and you've got to look to the gut first. Microbiome, leaky gut, inflammation in there, all these different things. Heal that gut up, and a lot of times the skin gets better. Number 2 for the skin is hormones, and are they not processing them out appropriately? Do they have excess estrogen? Is their liver not working? All of those different things. So I would go a lot of different directions before I put my kid on Accutane. So hopefully that helps. If you've got more questions, that's a pretty deep one, go ahead and send us a direct message and we can talk to you about that in more detail. Susan, thanks for the share, and say keep up the good job. Your page is phenomenal. GM, great to see you. Thanks for the kind words. Leslie, awesome. Thank you. And let's see what else. Pop those questions down below. Sherry in Nebraska, great to see you. And hearing of adults who say COVID antibody tests show they do have antibodies even though they are not vaccinated or haven't haven't had an infection. So here's the deal. We've known all along that there's a lot of people, and we talked about this a year and a half ago, there's people that are getting exposed to COVID. Absolutely. Think about this. I've had patients where they have one spouse is sick, lying in bed, whatever, and the other spouse sleeping with them, kissing them, drinking out of their water, whatever, throughout that whole time, and didn't get sick at all. Well, sick is a relative term. I guarantee you in the year and a half of COVID, I have gotten exposed. I have not been sick. I have not been down, a week of achy, there hasn't been a COVID in my life. I guarantee you though, I have had people walk through, breathe on me at Costco, a patient sneeze on me that I didn't realize they had COVID, whatever it is, I guarantee you. And yet my body may have had an immune response to that and may have made antibodies. I haven't tested in a while, and I'm not that concerned about it at this point as far as antibodies go. And so can somebody create antibodies and not have a full-blown illness and have outward symptoms? Absolutely. And here's the other thing is, a lot of people, and those ones that maybe haven't gotten sick, they still had T cells to other coronaviruses. Remember, coronaviruses are common cold, other SARS, these have been around for a long time, and so it's close enough for some people that their body knows what to do and can handle it and may not even get an illness from it. So, all right, Deanne, which office are you out of? I'm in Fort Collins in Colorado, and so that is my home, and that is where I practice out of, and I have Dr. Walden as well, and so he takes new patients here also, and then in Nashville we've got Dr. Steiner as well, and then we'll be bringing on 2 new clinics, and so we'll have some new ones there. Lana, Pueblo, Colorado. Good, yeah, we'll be hitting Colorado Springs in the next 6 months as well. I was going to take chlorophyll for low red platelet count. Is that good, and what causes a low count? Here's the thing. With low platelet count, you've got to figure out why. Yes, you could take some chlorophyll, and that might give you some more platelets, or if you're saying platelets or red blood cells, not sure which one you're talking about. red platelet count. So it might be red blood cell count, but or even with platelets, you've got to figure out why that's low in the first place. If it's red blood cells and your hemoglobin's low, you've got some type of anemia. Even if your iron's fine, it could be a B12 anemia as well, which you look for what's called MCV and MCH. So write that down, look in your blood work. If those are at the high level, then it may be more of a B12, a pernicious anemia, which could even be autoimmune. If it is platelets, you've got to rule out ITP, rule out autoimmunity where you're attacking your own platelets. But even either one of those, you still have to figure out the why. Why is the body going haywire? Why is it inflamed? Why is it creating these inflammatory states in the body? Lana, the blood sugar thing can be real tricky, laugh out loud. It can be tricky or it can be really simple, especially if you're tracking your blood sugar, especially like our patients that use the continuous glucose monitor. If you're tracking that and you can see every 5 minutes and you go, you know what, sweet potatoes make me go up to 160. I'm not gonna eat sweet potatoes. That's not tricky, that's pretty simple. If you see that you ate a certain salad or a stir fry or whatever it is and you stayed under 110 and nice and simple in there, put that in your good column, eat more of that, less of the stuff that makes it go up. So don't get complicated with it. Don't try to be like, oh my gosh, what's that one little thing? Just, good stuff, bad stuff, do more of the good stuff and that blood sugar will definitely come into a better range there. Do we accept health insurance? So here's the deal with health insurance, and especially looking at this side of the spectrum of healthcare. Unfortunately, health insurance is there not to prevent disease, not to truly treat that underlying condition. It's there to make sure somebody's not going to die, to give them a prescription medication, to give them a surgery, and they'll do that all day long. You go to the hospital and get an MRI and this, that, the other, and it's $8,000, and they're like, I don't know what happened. They'll pay for that all day long, but to actually pay for something that's going to reverse and fix, and we can literally reverse type 2 diabetes in 6 to 8 weeks. We've done it all the time. And it's not us, it's the body. It's you give it the right things, eat the right way, and the body can reverse full-blown diabetes, save the healthcare model, it's actually sick care, save the sick care model $1 million on that one person if we spent 3 months on fixing their blood sugar and reversing what they have going on. It pennies, I mean, not even pennies on the thousands of dollars, not even pennies on the dollar, we would save the sick care model. And yet, unfortunately, that's not how it's set up. They're not going to pay for, some of them will, some will pay for neurofeedback, some will pay for some nutritional counseling, things like that. A lot of people have $5,000 deductibles and that's kind of it anyway, so we're not even going to hit that. Some people, they can use their HSA. We do have payment plans available, a lot of different ways to make it as doable as possible. If somebody truly wants to get better, we'll do what it takes there. Taking antibiotics, can I still do probiotics and my multivitamin, and will they be effective? So the probiotic, probably not a whole lot. We usually have people wait until they're done with the antibiotic, but if you do keep taking that probiotic, if you're taking the antibiotic in the morning, take the probiotic at night. But usually what I say is you want to go a pretty high dose after that antibiotic, and usually at least 3 times as long. So if it was a 7-day, do it for 21 days of the probiotics. And chronic brain spin, totally have this. And all the time I thought it was just me. What is the solution? Well, people say, oh, it's not all in my head. Well, maybe it is all in your head. But when we say it's all in your head, that's why we look at the brain map. And so it's not just you're making these things up, but if that brain is spinning, if we're constantly ruminating and thinking about what we should have said in that conversation or what that song, any of these different things, we've got to go through and figure out which brainwave pattern is out of balance, and it's usually your alpha, that relaxed meditative one. People like this usually can't lie down at the end of yoga and relax their mind. So that's where neurofeedback comes in, and we can train those brain waves to get better. And yeah, got your book, good job. Went the other one to weather changes. That's a great question. if it's a extreme one, like you're living in Michigan and going to Florida for a couple weeks or whatever, that's going to be more of a challenge. But I think with acclimating to the weather changes, you've got to ultimately let your body kind of have some extremes anyways. And we get so, I'm not gonna say babied, but we're so like, oh my gosh, if it's not 72 degrees, I don't feel well. And okay, maybe if you live in San Diego, you're lucky enough to feel that way year round. But for most people, it's okay to have some swings. At night, we've got baseboard heat in our room, so we can keep our room separate. We're at 60 degrees at night. Unless it's summer, and then we're hotter through there because we don't keep the air conditioner on at night. But we're keeping it colder there. When you go outside, it's okay to be outside. It's okay to be hot or cold or do some of those things. So you've got to give your body a chance to do it. But what happens if we're kind of babying ourselves and be like, okay, we've got to be in this fixed environment all the time, and then you go and the weather changes, or you're going to be outside more, whatever. It's a lot more extreme to it. So definitely give your body a chance to acclimate versus just suppressing those. And I've got a couple more minutes here. Food sensitivities that cause the acne, absolutely. To find the right one for you, start by discussing it with your doctor and ordering some tests. Yep, absolutely. Gina, you are so welcome there, and I'm going to have to jump. Okay. All right, guys. If there's any other questions I did not get to, Brittany will be keeping an eye on those all day. So even if you catch a repeat, go ahead and ask those down below, and I will be doing that. Love having you on. Thanks for the questions. Lots of great thoughts out there. Remember, it's not just what's the magic pill, what's the magic thing that's going to work, but the why. We have to keep getting back to the mechanisms of why something is not working, and that's how we figure these things out. If you've got questions, DM us. That's a great way to just even talk to our new patient coordinator if he might be a good fit for the program. We work with patients all over the country, out of Tennessee and Colorado. So love having you guys on. Also, I forgot to mention, if you signed up for our email list, check your junk mail. We sent one out this morning, and I checked my junk mail, and that's where it was. I was like, I don't see it in the regular one, and Brittany said, check your junk mail. I'm like, I never check my junk mail. Well, it was in my junk mail. So check in there for email. It was a good one that came out this week. Let me know what you guys think. Any feedback, I appreciate that. But love having you on. Share this. We're going to get another book out. We're going to get this message out. People need to know how to get their bodies healthy again. So make it a great day, guys. Stay strong.